that's what we discussed on this program. That's my way of saying good afternoon and welcome to the program Women Voices for Peace, a program sponsored by ONEP, West African Network for Peace Building. They are the sponsors of this program. And have I said Happy New Month to you? Happy New Month, everyone. Oh God, it's so good to be alive from the beginning of the year to December. It's not by our making, surely it's the mercies of God. So happy new month, and today happens to be World AIDS Day. Every December 1 is celebrated worldwide as World AIDS Day, and that's the focus of our discussion today. All right, I have two young women, young doctors. That does not mean that they are young in the profession. They're they have a lot of experience in the field of medicine. Okay, let's start this way. I have with me Dr. Kaladada Korwa, consultant hematologist, UPTH, senior lecturer in hematology at Uniport. Madam, you're welcome.
Thank you very much.
Okay, and I also have a Dr. Owusive Madoka, a consultant as well, public health physician at UPTH. Madam, you're welcome.
Thank you very much, Rachel. Happy to be here.
Okay, my name is Rachel Onah, and Lucy is still somewhere around the corner helping us with one or two in the studio. Okay, so what is HIV? Meanwhile, the theme for this year is communities make the difference.
Yes.
Okay, Dr. Kurbo, what is HIV?
Okay. HIV actually stands for Human Immunodeficiency Virus, and it's a virus that infects a type of white blood cells in the body. The white blood cells are cells that help in immunity, help give us resistance to infections and things like that. So HIV basically is a kind of virus that enters the body after it has been transmitted by several routes. We'll talk about that. And when it gets into the body, it infects a particular type of white blood cell called the CD4 cell. And the end point is that in infecting these CD4 cells, which helps the body normally in immunity, it now destroys the immunity of the person, and that is why it is called immunodeficiency. So it reduces the immunity of the person, therefore making the person more at risk to develop what we call opportunistic infections. That is infections that somebody with a normal immunity may not have gotten. So these people that get infected with HIV are at risk of it. And then also what the HIV virus does, because it also reduces immunity, because immunity also helps us fight cancers. So it also increases the risk of people infected with HIV in getting cancers.
Okay, Dr. Maduka, at what point do we transit from talking about HIV to talk about AIDS? Where does it graduate to AIDS, from HIV to AIDS?
So HIV is the virus that causes the infection. The HIV virus causes the infection. Now, AIDS, acquired immunodeficiency syndrome, is when the person who has the virus has started to manifest certain signs, what we call signs and symptoms, that classically look like, what we call the syndrome, AIDS syndrome. So, extreme weight loss, loss of appetite, the person is frequent stooling and vomiting. So, one stage of the AIDS syndrome, or the syndrome or the other, once the person is at that place where there are different diseases that are now being manifest, all the opportunistic infections that Dr. Kodo spoke about, they'll say this person now has AIDS.
Okay.
So AIDS is the disease, HIV is the virus and the infection.
And in addition to that, there are some people that may have not, and they may not have yet been tested for HIV, but they could come down with features of AIDS. So we have certain disorders that we call AIDS defining illnesses or AIDS defining diseases.
So what are those?
Well, they are like some of them are like Kaposi's sarcoma.
Please calm down.
It's a type of
You're
cancer.
You're not
there are certain types of cancers There are certain types of cancers that are caused by HIV. Certain type, like the Kaposi sarcoma, affects the skin. You have certain kinds of lymphomas, which is a type of blood cancer. You have some other types of cryptococcus, a kind of fungal infection. So there are different ones. Let's not bore you with big
Okay.
medical words.
Oh,
But what we're trying to say is that when the medical personnel attending to these patients that just presented sees any of this, even if the person has not been tested for HIV before, that's an AIDS defining illness.
okay, Dr. Maduka, at what point should a person really suspect that, okay, it's like he or she is having signs of HIV? At what point should the person get tested?
It's really interesting, Rachel, because we don't want to wait for someone to start to have signs of the infection or signs of the AIDS the disease. What we'd like to say is that everyone should know their status.
Okay,
You know, there's a
what do you mean?
common
What do you mean
saying, they say
by
HIV know the show for
yeah?
face.
So what do you mean by people knowing their status?
Exactly. So knowing your status means going to have a test, a simple blood test. It's a rapid test. The result comes out in a few minutes. You take a little bit of your blood, a drop, and put it in a very small machine and add some liquid to it. It runs through a paper. And if it's 2 lines, it's positive. If it's 1 line, it's negative. Just like a pregnancy test or a malaria test.
Or
There
using
is a
blood.
specific test for HIV, and you just know, do you have HIV or do you not have the virus? And that's actually the best way. So we actually encourage everyone to go get tested
Okay.
to know. Let's not wait for signs and symptoms, because by that time it's really late.
And the other thing is that testing is not, because there are some people you ask, have you been tested for HIV before? And then they'll tell you yes, in 2012. So testing is not a one-time thing. Testing should be done frequently, at least once every year.
Okay, now there are scenarios that have played out in families. Now, some men, they get the disease and they hide it from their partners, and then some women too get it and hide it from their partners. What should be the ideal thing? Okay,
It's a
Dr.
complicated
Maduka, have
issue.
you come across in your okay, you're lecturing, you're practicing. Have you seen such scenarios play
This is
out?
something we see very frequently. Very, very, and sad enough, it is something that we have to deal with almost on a regular basis. So because of the fear of disclosure means just tell your partner what's going on with you, what your own status is. Because if you are having unprotected sexual intercourse with anybody, that person is at risk of getting what you have. So it is only fair for you to disclose and let the but you see there are so many scenarios and situations where the male partner may not want his female partner to know, the female may not want the male to know,
And some people
and so
even
on and
go
so
ahead
forth.
to take the medication without letting their partner know, and this partner will get the disease and eventually die.
So the thing is this: when we see such situations, we do everything in our power to counsel, to help to bring those people to the point where they are ready to tell their partners. In fact, to the point where we'll ask you to invite your partner and we'll have a session and help you break the news to your partner in a way that will be received and accepted properly. Because some of the challenges, some of the concerns people have are genuine. I tell him he will break my head. I tell him he will kill me. I tell him he will pursue me from the house. Those kind of things. But there are some people who actually are hiding it because they don't really care about the other person. So at that point in time, it's important for all those cards to be put on the table, and we will actually help at the health facility to manage those dynamics to a point where the other person, you need to let him or her know. And the interesting thing is that right now, with the way the treatment is going, with the way the availability of the drugs and how good those drugs are, how effective those drugs are, you can have someone with HIV married or have a partner who is HIV negative, and the person will never get the virus.
Really?
Yes.
Even mother to child transmission.
Stopped completely once treatment has been commenced and treatment is being adhered to. Those kind of things can be ensured. So people don't have to be afraid again of losing relationships because of the virus.
Now, getting people to get tested, that's one of the biggest
Yes,
problems
it's one
right
of the
now.
biggest problems. But you see, it's also how we approach it. People need to understand that HIV is no longer a death sentence. I mean, in the early 80s, when HIV first was, discovered and all that, it was at that time a death sentence because people didn't really understand the virus. People didn't really know how it came about, brought about the symptoms and signs and the progress and all that. But and then at that time, treatment was an issue because of drug availability. But over the years, there has been so much research into HIV. And like Dr. Maduka said, the research has gone to the point that even infected partners do not transmit the disease to their spouse if they are taking treatment and adhering so far as they are responding to that treatment. So now we need to remove that fear that look, HIV is not a death sentence.
Okay.
So people who are diagnosed with HIV can get treated and go about their normal daily lives. So once people understand that, then it will be easier for people to come and get tested. We want to remove the stigma that is associated with HIV. Now, in terms of testing, if we go to the theme this year, community-based approach, the World Health Organization has shown that the community approach to testing and treatment is what will reduce the epidemic of HIV. And the target is to reduce the epidemic of HIV by the year 2030. So for us to get there, it's not a one by one, you come, you come. We should now be approaching HIV testing, HIV treatment, in HIV prevention, HIV testing, HIV care in communities. Because we are here, but you have people that are, in small, small villages. Have those people been tested? And if you go and look at the statistics of people that are actually living, how people that are infected with HIV, the national prevalence, I think they say, is about 1.3, 1.4%. But if that is national prevalence, if you take it state by state, the South has one of the highest prevalence, which is about 3 point something. So that's even double the national prevalence. So it means that we should take it seriously. And it's very simple. Like Dr. Maduka said earlier, know your status. Now, when you know your status, what is the status around the people beside you? Your husband, your wife, your children, your neighbor, and so on and so forth. If everybody knows that, look, we should know our status, and if you've been tested before, continue to test frequently. There are
What do you
some
mean by
people.
frequently? How often?
Yes. Now, when I say frequently, for example, I'm a health worker. I'm a hematologist. I come in contact with blood